Hello, I'm Edward Salt. Welcome to Monday South Today. Coming up in tonight's programme.
But at 12 midnight, we're going to be 25 beds short.
A shortage of beds, patients waiting in corridors and queues of ambulances outside.
I came in 10 to 8 this morning and there was a queue of patients in the corridor. We had an 11-hour wait.
Queues of ambulances outside hospitals, patients waiting in corridors and a desperate shortage of beds. These are now everyday scenes in hospitals across the country, including here in the south. At the Royal Bournemouth Hospital, winter pressures means a bed deficit. Now that means they start every day with fewer beds than they need. One of the issues is with patients waiting to be discharged back into the community. Now teams in Dorset are finding new ways to keep people out of hospital in the first place. Here's our health correspondent, Alistair Fee.
This is what winter pressures look like. A hospital so stretched that patients wait in corridors.
Everybody's so busy, rushing around, and they're all doing their best.
The beds in this emergency department and on the wards are full. They've seen a massive increase in patients in recent weeks.
I came in 10 to 8 this morning and there was a queue of patients in the corridor. We had an 11-hour wait. We were very busy this morning, yeah.
Now, are you OK if we take a blood sample from you this morning?
So everything possible is being done to keep patients who don't need a stay in hospital out.
You trust them, you know that they're doing the best for you. You're not occupying a bed.
David has had a fall. An appointment to come in to see a dedicated on-the-day team was booked by a GP.
We've got the team to assess them very quickly. You know, sometimes they come into ED, they may be waiting for hours to be assessed, simply because they haven't got enough staff. Or they might go up to the admission unit to be clerked, but there's not enough junior doctors, so that doesn't happen for hours. So actually what happens here happens in a timely fashion, which is also really important.
It's a marvellous hospital. I've had lots of treatment here before, and it really is fantastic.
Elizabeth spent 2 hours waiting in an ambulance outside the hospital, but now has better news.
We'll take you up to our clinic and do all your blood tests and everything from up there. Good. And then we can get an assessment done so I can try and get you home from that clinic.
She too is seen by the same-day emergency care team and later went home.
We work from the ethos that we are going to do everything we can to prevent that patient having to come into hospital. You're able to do a really good job for your patients, which is what we're all here for at the end of the day.
I don't want to go into hospital. I try my hardest to stay away from the hospital.
Caring for patients at home is another way to protect hospital beds. Today, Ella is delivering a walker to keep Woody on his feet.
I do appreciate them, I really, really do. You know, you don't know how much I appreciate them.
Because, of course, those beds in hospitals are precious and many people need them.
Yeah, oh yeah, Christ, yeah, I agree with that, yeah. Yeah, I stay out of it as much as I can. What would I do without the NHS? And what would I do?
Last month, the team kept 47 people out of hospital and helped another 57 return from hospital to their homes.
If you are medically unwell and you need that care of the doctors and the nursing team, then the hospital's the right place for you. But patients that are medically well and actually they need that support, maybe rehab or that extra piece of equipment, we know those patients are best to be kept safe in their own environment, and what our service is doing is supporting patients to be able to remain in their own homes safely.
Today we're expecting 102 emergency admissions. Some of those have arrived already. We're expecting obviously some discharges, but at 12 midnight we're going to be 25 beds short. Every single day in the morning, first thing in the morning, when we look at that predictor, there is a minus number at the end of the day. And our challenge every day is how can we work in the organisation, with clinicians, with our patients, with the outside agencies, to get that to a positive number, or at least a 0, because we want our patients in beds.
Have you got any questions for me?
Having been checked over, David is another patient able to go home. Had he not been cared for by this team, he would have been admitted to a ward. More than ever before, every bed this winter will be precious, and it will take every effort to keep them free for those who need them most. Alistair Fee, BBC South Today.
Well, our political editor, Peter Henley, joins me now. Peter, winter pressures, of course, are only going to increase. What are the government doing to help hospitals like Bournemouth?
They're spending a lot more money, they're recruiting staff, they're trying imaginative new techniques you saw there, learned during the pandemic, but it's only scratching the surface, really. I mean, and staff are leaving because the pressures are so great. We talk about winter pressures. It's the people being iller because the temperatures are lower. It happens towards the end of November, runs through to February. The NHS knows it's coming, but this year, staff who've been working 20, 30 years in the NHS say they've never seen it as bad at this time of year. It's because of COVID, it's because of the backlog, because people didn't get treatment during lockdown. But really, you know, yes, there's going to be more vaccinations. The booster vaccinations are up to 12 million now. A lot more people getting flu jabs, but this is going to be very difficult.
OK, Peter, for now. Thank you. Peter Henley there.